Hello, my name's Summer. Today we're going to do a neuro exam and a musculoskeletal exam. To start with, my patient does not appear anxious. His clothes are clean and he's well groomed. Can you tell me where you are right now?
Home,
And what's your name?
Josh,
And what year is it?
2019.
Patient is alert and oriented to person, place, and time. I'm just going to ask you a few questions and you answer however you think is appropriate. What is 2 plus 2?
4,
And 4 plus 4?
8.
Good. Your calculation is intact. Now, if you were standing outside and it started to rain, what would you do?
Go inside.
Okay. Your judgment is good. I'm going to give you three different words. As soon as I tell you the words, I want you to repeat them back to me. Ball,
Ball,
pen, cup.
ball, pen, cup.
Your immediate recall is intact. Now, I want you to remember these words for later on, and I'm going to ask you them again. We're going to go ahead and start with our neuro exam and testing our cranial nerves. So, cranial nerve 2 is your optic nerve, and cranial nerve 3 is your ocular motor nerve. To test cranial nerve 2, you can do a visual acuity, but since we don't have a chart, we can test perla to see if they're intact. With cranial nerve 2, that gives the sensory that your eye needs to constrict, and then cranial nerve 3, the ocular motor, is actually when the eye does constrict. So I'm just going to have you look straight ahead. I'm going to take a pen light across your eye. When I take the pen light across his eye, he has direct constriction, and then when I take it back across, he has consensual restriction to the other eye. So this tells me that cranial nerve 2 and 3 are intact. Now for accommodation, we're going to go ahead and check that. I just want you to look at my pen light here. As I move it closer to you, just follow it. His eyes do come in, they converge inward, and his pupils constrict. So it tells me that accommodation is intact. Perla is pupils are equal and reactive to light and accommodation. And then to check the extraocular motor nerves of the eyes, that's going to be cranial nerve 3, which is the ocular motor, cranial nerve 4, which is the trochlear, and then cranial nerve 6, which is the abducens. So again, watch the pen light and don't move your head, just move your eyes. Good. That shows me that his cranial nerve 3, 4, and 6 are intact. Next, we're going to move on to cranial nerve 8, which is the vestibulocochlear. That's going to test his hearing. So you stay there. I'm going to come behind you and I'm going to say a word, and you just tell me what I'm saying.
99.
Okay? And again,
88.
good. So cranial nerve 8 is intact. Next, we're going to go down to cranial nerve 5 and cranial nerve 7. Cranial nerve 5 is the trigeminal, and this is the sensory. If something touches your eye, your corneal reflex, then you'll want to blink. When you actually blink, this is cranial nerve 7, which is your facial nerve. So I'm going to take this cotton ball to your eye. Okay? Normal response is that he will want to blink. Again, that's cranial nerve 7 when he actually does blink. There's two other ways that we can check cranial nerve 5 and 7. To start with, for cranial nerve 5, trigeminal, we're just going to touch his face with a few different objects and see if he can pick up where I'm actually touching his face. So go ahead and close your eyes. When I touch your face, just tell me where I'm touching you.
Forehead. Chin. Cheek. Right cheek.
Would you say that was sharp, dull, or soft?
Felt like a cotton ball, I'd say soft.
Okay, good. Keep your eyes closed and we're going to go again. Just tell me where I touch you.
Right cheek. Left cheek. Forehead. Chin.
All right, that was a tongue depressor. Would you say that's dull, sharp, or soft?
Dull.
Good. All right, one more time. Just tell me where I touch you.
Forehead. Left cheek. Right cheek. Chin.
Okay, is that dull, sharp, or soft?
Sharp.
Good. So that tells me that cranial nerve 5 trigeminal is intact. Now we're going to move on to cranial nerve 7, which is the facial nerve. Go ahead and puff your cheeks out for me. Smile and look surprised. Raise your eyebrows up. Okay, good. So cranial nerve 7 is intact. We're going to move on to cranial nerve 9, which is the glossopharyngeal. The glossopharyngeal is the sensation that you have to gag. When you actually gag, that's the motor response, and that's vagus nerve 10. We're not going to make you gag, but we just need to make sure that the nerve is intact. So go ahead and open your mouth and say, ah. Stick your tongue out. Good. So when he does this, the uvula rises. It is midline, and then the posterior pharynx, it rises bilaterally. Again, if he was to vomit, that would be the motor response from vagus nerve, from cranial nerve 10, which is the vagus nerve. We're going to move on to checking the accessory nerve, which is cranial nerve 11. I'm going to put my hands on your shoulders and then just try to lift your shoulders up. Good. That checks the trapezius muscle. Now I'm going to place my palm on your face and I want you to turn your head towards my palm. Good. And this is the sternocleidoid mastoid muscle, and that tells me that cranial nerve 11 is intact, which is the accessory. And then the last cranial nerve that we're going to check is cranial nerve 12, and that's the hypoglossal nerve. What I need you to do is just stick your tongue out and then move it side to side. Good. That tells me that cranial nerve 12 is intact. His tongue remains midline. There's no tremors or fasciculations that are noted there. Now we're going to move on to the shoulders and testing muscle strength and the musculoskeletal part of the exam. So start with on the shoulders. Put your arms down by your side. Move your arms out. This is abduction. When he comes back down, this is adduction. Good. Go ahead and sit to the side of your chair. I want you to take your arms up above your head and behind like you're stretching. Good. This is external rotation of the shoulders here. And then go ahead and take one arm like you're scratching the opposite shoulder blade. Good. This is internal rotation. You can go ahead and turn back around. Now we're going to check the elbows. I want you to flex like you're showing your muscles. Good. This is flexion, down. We're going to do extension. Good. Open your palms. This is supination and then turn over. That's pronation. Good. Okay, you can put your arms down. We're going to go ahead and check your wrist. You can do one or both wrists. We're going to turn inward for internal rotation, outward for external rotation. We're going to go up for extension, down for flexion. Open your palms. This is extension of the palm. Make a fist. This is flexion of the palm. And then you can turn your hands over, open your fingers, abduction, and then close it as adduction. Good. Okay. Now we're going to move on to grips of the upper extremity. I'm going to put my fingers in your hands, and I want you to grab them, and then don't let me pull them out. Okay, good muscle strength there. Then hold your arms up like this. Don't let me pull them down, okay? Good. You can go ahead and put those down. Next, we're going to check your finger dexterity. One or both hands, I just want you to take your thumb and touch each of your fingers, go back and forth very fast. Okay, I'm not seeing any tremors there. Good, and now we're going to do supination and pronation with your hands. You're just going to flip them back and forth very fast to make sure there's not any tremors there. There's not. Good. Next, I'm going to check some neuro to make sure you can follow commands and there's not any tremors there. I want you to take one index finger. Don't move your head. You're going to take your finger to your nose and to my finger. And as my finger moves, just follow it, okay? Okay, back to your nose each time. Good. Okay, good. Now, while we're here, we're going to check to make sure he can move his heel from his knee to his shin to make sure there's not any tremors there and there's not an S curve. So take the heel of your right foot and you're going to go from your knee to your ankle on your left leg and just go up and down. Yep, up and down. Good. There's not any tremors there and there's not an S curve. Okay. Now we're going to move down to the lower extremities to check muscle strength there. I'm just going to put my hands on your thigh and I want you to try to bring your leg up to your chest. Good. Okay. He's sitting in a flexed position now. I want to have you extend your left leg just straight out in front of you, and that's extension. Good. Okay. Now we're going to check your ankle. I want you to take your ankle and turn it inward for internal rotation, then outward for external rotation. I want you to bring your toes to you. This is dorsiflexion, and your toes down, which is plantar flexion. Good. Now I'm going to come down here and check your muscle strength. Can you kind of hold your feet up a little bit so they're off? Okay, pull your feet towards you. All right, and now press on the gas pedal. Good. So for upper and lower, you can put your legs back down. For upper and lower, he has 5 out of 5 muscle strength. Next, we're going to check for a Babinski sign down in his feet. So let me have one of your legs, okay? And I'm just going to check to see what the response is. So normal response, let me do it one more time so you can see. Sorry. So we're going to start at the bottom, go up and underneath the toes. So a normal response here is for the toes to curve downward, and he has plantar flexion. So that is a normal response. Okay, I want to have you go ahead and stand up. We're going to move the chair out of the way. And if you want to start at the back of the room, I want to have you walk a straight line. You're just going to do toe to heel, take a few steps, and then turn around and do the same. Okay, you can turn around. This is tandem gait, and it's showing that it is intact. Okay, good. Turn around. I want you to walk towards me on your toes. Okay, and then turn back and walk on your heels. This is checking plantar flexion and dorsiflexion. Good. Next, we're going to check a Romberg sign. I want you to stand with your feet together, your arms down by your side, and your eyes closed. And I'm going to stand next to him to make sure he doesn't fall over. There is a little bit of swaying, which is normal, but this is a negative Romberg sign, and there's no ataxia noted. With your eyes closed, take your arms and put straight out in front of you with your palms up. Good. Again, there still is a little bit of swaying, that's fine, but he does not have any pronator drift with either one of his arms. Okay, you can put your arms down. Alrighty, and for last, we're going to go ahead and we're going to check abduction and adduction of the hips before we move on to the reflexes. So take your right leg and move it out to your side, just straight out. No, you can keep your eyes open. Just move your leg out and in. Okay, good. Now, I'm going to have you have a seat on a stool. We're going to check your patellar reflex. A normal reflex is at +2. So we're going to look at the patella of the knee, and then we're going to go right below it for the tendon. And a normal response, you'll see his leg move just a little bit. Okay, so we have a 2+ response there. And then turn to your side some. We're going to check his triceps reflex here. Just take your arm and let it dangle down to the side. Move my camera again. Okay, I'm going to hold it up, and then you should just see a little bit of movement of the arm. Good. You saw the arm move here and the fingers. So that's 2+. And then for the last one, we're going to check his Achilles reflex. All right, I'm going to have you move one more time to the chair. We can bring that over here. And then just put one knee on and kind of turn to the side if you can a little. Yep, that'll be good there. So for the Achilles reflex, we're going to find the Achilles, and then we're going to go to the tendon here, and you should see the foot move a little bit. Good. He has 2+ there. Okay, that completes our neuro and musculoskeletal exam. Thank you.